And I suppose in some ways what I want to talk about today is related to the pressure that we see on EDs and in hospitals, because it speaks to the staffing issue that we're experiencing in the health service and the ongoing issue of long COVID and how it affects healthcare workers. And by healthcare workers, I don't just mean nurses and doctors, but I also mean healthcare assistants, cleaners, housekeeping staff, the catering staff, porters, every person who, when we were all told to stay at home and mind ourselves and cut down on our contacts, they were expected to go out to work. And not just to work during the middle of a global pandemic, but to go to the epicentre of that pandemic and go into places where we knew people had COVID and sometimes in cases where we knew that the protective equipment that we were giving them wasn't adequate. And when we talk about long COVID, we're not talking about people who, experience COVID and then maybe it takes them 6 to 8 weeks or maybe 12 weeks to recover. These are often people who, after 2 years, after 3 years, they're still experiencing very, very severe symptoms. And, we don't have a particularly good track record in this country of dealing with post-viral illness, but certainly, even though it can be nebulous to diagnose, it's very real for a lot of people. People experience things like debilitating fatigue, a difficulty of getting out of bed or getting through your day, brain fog, joint pain, muscle pain, insomnia seems to be an issue that I hear over and over and over again, and vertigo. Now, those are probably symptoms that all of us have experienced to some degree at some stage in our lives. But if you're experiencing that all day, every day, it really does impair your ability to work. And we know that a disproportionate number of healthcare workers are experiencing long COVID, and certainly their unions would be very well able to speak around how many people are experiencing this. These people have acquired long COVID in conducting their duties as healthcare workers, in minding us, in looking after us. They have contracted a long-term illness that is affecting their ability to live their lives and to do their work. And on top of that, it is now affecting their financial security and the security of their long-term employment and their general well-being. We do recognise in this country, that when you contract an illness or a condition through your work, that the state should support you. And we do have a system of recognising prescribed diseases or illnesses as set out in the Social Welfare Consolidation Act of 2005. And in Section 87, it sets out 2 criteria. The first criteria is that the illness has been contracted as a risk during their occupation, not as a risk that is common to all. And I think we can all accept that those people who are working in emergency departments, who are working on wards, who are working in hospitals or primary care, and who were dealing with people who were suffering from COVID-19 themselves, were at more risk than the rest of us who got to stay at home. And the second criteria is that that illness can be reasonably attributed to their occupation. And I don't think that we can argue with that. People who looked after us during COVID got COVID themselves. Now, we know that other countries have an occupational injury scheme for healthcare workers who are disproportionately affected by long COVID. France is doing it, Italy is doing it, Denmark is doing it, Sweden is doing it. It's being introduced in countries throughout Europe. And the EU Strategic Framework on Health and Safety at Work that runs from 21 to 27 highlights long COVID and says that this is something that we should be looking at. It does affect healthcare workers. It is a real thing. It's very easy to dismiss and it's hard to diagnose, but that doesn't mean that people should be put at financial risk, financial insecurity and employment risk in the long term for minding the rest of us.
Thank you, Alaska Count Corlin. I wish to take this on behalf of Minister Donnelly and thank Deputy Horrigan for raising this issue. The Department of Public Expenditure and Reform introduced special leave with pay for COVID for all civil and public sector employees at the start of the pandemic to assist in the prevention of onward spread of COVID in work premises. Currently, special leave with pay applies for all cases for the duration of the self-isolation period only. Any periods of COVID-related illnesses which extend beyond the isolation period are treated as ordinary sick leave. A temporary 12-month scheme specific to the Public Health Service was introduced to provide for paid leave for certain Public Health Service employees unfit for work post-COVID infection. Employees who met the eligibility criteria for the scheme will have transferred to the scheme in July 2022. The temporary scheme, specific only to the public health sector, was introduced in recognition of the higher risk faced by certain public health service staff who were required to work on-site through the most challenging phases of the pandemic in clinically exposed COVID-19 environments. In respect of long COVID, it is our understanding that an epidemiological survey is planned by the Health Service Executive, which will provide much needed insight into long COVID, which is not fully understood from a clinical perspective. The HSE has commissioned a review by the Health Information and Quality Authority to assess the latest international evidence on long COVID. The EU Advisory Committee on Health and Safety at Work have recommended the recognition of COVID as an occupational illness in health and social care. However, Member States vary in respect of their treatment of COVID in this regard. Officials from the Department of Health have met with officials from the Department of Social Protection who operate the National Occupational Injuries Benefit Scheme. The Department of Social Protection have indicated that COVID does not currently constitute a prescribed disease or illness as set out in the Social Welfare Consolidated Act of 2005. I understand that the Department of Social Protection have committed to reviewing the EU Committee recommendation in respect of the occupational recognition of COVID and reporting back to Social Protection Select Committee on this matter. As part of the DSP review, Minister Humphreys has sought input from Minister Donnelly in respect of this matter. Minister Donnelly has asked officials from the Department of Health to examine the options in respect of the recognition of COVID as an occupational illness in the public health service, with the intention of replying to Minister Humphreys on this matter without delay. And this matter now is currently under consideration. Thank you, Councillor.
And as you can see there, the state has actually already recognised, through the creation of that temporary 12-month scheme, we have recognised that healthcare workers were at higher risk and therefore have to be treated in a certain way. I'm sure you're aware that where people are put on standard sick pay, that essentially means that they're on a pathway to medical retirement. And we're talking about people who are in their 30s and 40s and 50s. Not only do they have the financial burdens that come with that, kids in school and all that kind of thing, they're also, very young to be putting them on medical retirement, and it might be that we can manage this process in a better way. I'm glad to hear that Social Protection are doing a review, and I certainly will be following up with that. I would hope that Social Protection and the Department of Health are engaging with unions on this issue, because I am aware that in certain CHOs, occupational health departments, are kind of putting pressure on workers to return on reduced hours and trialling that, and then they move off the 12-month scheme, and that 12-month scheme is about to run out. And while we're dilly-dallying around whether it is an occupational injury or not, those people are experiencing huge insecurity about what the future looks like for them. It's really not fair for people who, have given their all in supporting us and minding us. There are two further things I think that maybe we could pass on to Minister Donnelly, or Minister, maybe yourself could pass it on. The first is that there does seem to be a kind of a disconnect in terms of recognising what long COVID is, and something that maybe we could do very quickly is to communicate to GPs in the form of a circular or a one-pager. What are the symptoms of long COVID? What does it look like? We know it's difficult to diagnose. We know it's a kind of a nebulous series of symptoms, but it is a very real thing, and maybe we could support GPs to be able to recognise it sooner and kind of give people that security that their illness is being taken seriously. And secondly, there are a number of things that we could do in terms of providing support, such as making melatonin prescription free. It's prescription free in many European countries, but not in Ireland.
Minister, to conclude.
Thank you, Councillor Corlin, and thank Deputy Horrigan for those very important points that she's raised. Now, I will indeed pass on the two issues that you've raised to Minister Donnelly, and the Government absolutely recognises the huge role of our public healthcare workers throughout the pandemic. They have gone absolutely beyond the call of duty, working in the front line in COVID clinically exposed environments, treating COVID-positive patients in extremely difficult circumstances. Their efforts have and continue to have an incredible and hugely appreciated by government. Many of these frontline public health workers unfortunately contracted COVID in the workplace, and some still remain suffering from the symptoms of long COVID, as Deputy Horrigan has pointed out. While the temporary scheme of paid leave for certain eligible health sector staff suffering with long COVID remains in place, Minister Donnelly is acutely aware that this scheme concludes in 3 months' time. The Minister is also mindful that the criteria of the temporary scheme meant that not all staff who contracted COVID while working in clinically exposed environments were able to access the scheme. It is no noted that many of our EU member state counterparts have adopted the EU Committee on Health and Safety recommendation and have recognised COVID as being occupational in nature in the health sector in their respective countries, and have their recognition of same. However, their recognition of same varies in their approach. As I said, Minister Donnelly has asked his officials now to consider the matter further in light of the treatment of this by his EU counterparts, and has also committed to providing support to impacted staff as appropriate in this regard. Thank you, Neasa.
Moving on.